Hi everyone, my name is Chris Ma. I'm a gastroenterologist at the University of Calgary, specializing in inflammatory bowel disease. It's my pleasure to share this first part of a three-part series looking at extra-intestinal manifestations. So what are extra-intestinal manifestations, or EIMs? As you know, patients with IBD get inflammation in the gut, but some patients can also get inflammation that affects other organ systems. And we call these extra-intestinal, or outside of the bowel. Extra-intestinal manifestations can really affect almost any organ system. They can affect the eyes, the skin, the joints. They can affect the liver. They can affect the pancreas. They can affect the blood vessels. They can affect the bone. So there's really a very broad and diverse range of extra-intestinal manifestations. Approximately 10 to 20% of patients with IBD will develop extra-intestinal manifestations. And these conditions can occur after a diagnosis of Crohn's disease or ulcerative colitis, but they can also occur even before a diagnosis of IBD. Some of these EIMs will be more active when the guts are inflamed, but sometimes EIMs can be active and cause significant symptoms even when the bowel is in remission. So like I mentioned, there really is a very diverse range of different EIMs, and I'll give you a couple of examples of different EIMs that can occur. One of the most common EIMs occurs on the skin, where patients can experience a number of different types of rashes. These rashes can be painful. It can appear as sort of red welts, often on the shins. That's something called erythema nodosum. They can also be more ulcerated, a rash called pyoderma gangrenosum. There can be rashes that are more scaly and look like something called psoriasis. Or sometimes patients get recurrent boils or boil-like lesions called hidradenitis suppurativa. Another common extra-intestinal manifestation affects the eyes, and that can involve inflammation of the outer layer or the whites of the eye, something we call episcleritis or scleritis. Or it can involve deeper layers of the eye, something we call uveitis. And this eye inflammation can cause redness, can cause itching or burning, or in severe cases can cause vision loss. In addition to inflammation in the eyes, patients can get oral extra-intestinal manifestations, and that often looks like recurrent ulcers or cold sores in the mouth. In the joints, patients can get inflammation that causes swelling, stiffness, tenderness, and joint pain. And that can affect both small joints like joints in the hands, as well as larger joints like joints in the hips or knees. And there is also a special kind of inflammation that affects the spine called ankylosing spondylitis in patients with IBD. And that causes back pain and stiffness. Other rarer extra-intestinal manifestations include blood clots, as patients with IBD are at higher risk for blood clots. You can get kidney stones. Often that's a result of malabsorption from the last part of the small bowel in Crohn's disease. Or patients can get low bone density, and that can be a result from chronic inflammation that drains bone strength, or it can be the result from medications like steroids, which impair bone health. So as I hope you can recognize, there's really a diverse range of EIMs. And in the next section, we're going to talk about what to do if you're diagnosed with an EIM. Thank you.